Thank you.
Okay, did you want me to share the screen now?
Yep, that's good.
Okay.
Thank you, Taylor.
No problem.
Cool. So we just wanted to start it off by just doing some brief introductions about our team before we introduce the speakers. So thank you all for joining us at this event where we're going to discuss data to action. So how a few local folks, so researchers, community organizations, how they've transformed caring during COVID. So how they've used data to put things into action. Taylor, you can hit the next slide. So cool, I'm Erica Hager, one of the community engagement coordinators with the CTSI at Pitt, which is the Clinical and Translational Science Institute. Be here, Taylor.
My name is Taylor Scott. I am the health advocate at Urban League of Greater Pittsburgh.
Hey everyone, I'm Bea Schindler, also a community engagement coordinator at the CTSI at Pitt. And we're excited to be in this space thanks to Pitt Civic Action Week for hosting this space. So this should be pretty cool. So while we're here, in essence, this Lunch and Learn is about trust building. And to that end, while we may not often see this in a remote space, especially here on Zoom, we wanted to just, follow through with what we usually do during these Lunch and Learns, which is have some norm setting, which we feel like is critical. Feel free to use the chat box for any norms that we may have missed, but I just wanted to kind of quickly list off a couple, and actually I guess I could copy and paste this into the chat as well. But first, this is meant to be a safe space. We'll try our best in the short time that we're together. Secondly, if you have comments, keep those comments really personal, local, and immediate to yourself. So one way to really do that well is to use the I pronoun as opposed to the we. So really trying to keep yourself accountable. And while a safe space is critical, be also super mindful that not everyone in the space has consented to what you're about to say. So being aware of any triggers that can impose secondary trauma on folks in the room, just being really mindful of that. And also note your airtime. It probably won't really come up in this space, but again, while we want it to be a safe space, if you feel like you're sort of jumping in a bunch, there's a good trick where you think of 3 other folks that speak first before you speak again. Just imparting some I guess some group norms here and tips. Also practice people first language, so the person first before their identity. And also allow for folks to self-identify. So in particular, I'm thinking about things like pronouns or racial identity, right? Gender identity. My pronoun preference is be. You can also use they and them. So just wanted to set that space, and I can copy that in the chat as well. Next slide, please.
So for the Civic Action Week Lunch and Learn agenda, you can see it on your screen right now. So we are leveraging the experience of University of Pittsburgh researchers, the Pittsburgh Study, and the Urban League of Greater Pittsburgh as a way to explore the process of moving data to action. As the Clinical and Translational Science Institute, staff, we will be facilitating conversation around caring during COVID. Specifically, we hope um, you all leave with an idea of best practices for engaging in university community research relationships, including actionable steps to disrupt power in these spaces.
Actually, I just realized that's our old PDF. But quickly, just taking health and wellness into one's own hand. It's directly tied into what we're doing in 2020 with our partnership with the New Pittsburgh Courier, which is a historically Black newspaper here in the city of Pittsburgh, where once a month, ourselves, CTSI, along with partnership with UPMC, the Urban League, and of course the Courier, we work to discuss relevant health topics through the name of our partnership, which is Take Charge of Your Health. So on the right-hand side, you can see a short list of the health topics we've covered since November 2018. All of the health pages are archived on our CTSI website, including some videos capturing our accompanying lunch and learns, as well as some dinner and dialogues. Cool. So we just want to give a brief introduction to Dr. McTeague, but we, again, are mindful that she'll probably want to better introduce herself. So Taylor, if you want to stop sharing, Dr. McTeague, you can take it away.
Thank you so much. Is my video is working? Hello, everybody. It's really nice to be here. I'm so pleased and gratified for the invitation to present with you today. I'm going to try to go ahead and share my screen. Can you see those slides okay? I found with Zoom that I have a hard time getting rid of the little mini slides on the corner, so I'm going to just leave them there unless somebody can give me a tip about how I can present and not have it go off into a different screen. Seem okay?
It looks okay.
Great. So
thank you.
So I am gonna start with telling you just a little bit more about myself. I'm a physician researcher. I'm a general internist, but I stopped seeing patients a few years ago and still miss those day-to-day interactions. But wanted some more time to be focusing on research and teaching. And then one of my other major things is that I'm a mother. So my 9-year-old daughter is there in the picture. I love to garden. My research focuses on prevention, on how to help people make healthy choices, make those choices easier. They tend to be focused around healthy diet and exercise, and on engaging community members as partners in health research. That last goal primarily has to do with one of my major research initiatives is as one of the 2 lead investigators for the PATH network, along with Mike Bisich from the Pitt Department of Biomedical Informatics. PATH is one network that is participating in PCORNet. So PCORNet's a network of networks. I just one slide with a little bit of technical detail here, but I think it's helpful to understand that as context for the study I want to tell you about. So PCORNet is a network of networks with a goal to make it easier and less expensive to do patient-centered health research using real-world evidence. Really proud that Pitt is a part of this national initiative, and it's really exciting that the focus of PCORNet is to do patient-centered research. We'll talk a little bit more about that later, but the idea is that we're trying to get patients involved in the research process as partners, helping to steer the research and helping to answer the right questions, in the hopes that this may be one of the best ways of trying to change the healthcare system for the better. As part of this national network, this creates opportunities for our local researchers to actually lead national studies while working with patients and other stakeholders. And it also creates opportunities for us to participate in national initiatives led by other institutions. And the HERO effort is the latter. This study is being led out of Duke University, but Pitt and many other sites in the region are participating. A really unique thing about PCORNet is that our team members and our hospitals and health systems and health plans have been working together very closely for the last 5 years. And as such, we're well positioned to provide research support for COVID-19 studies. And finally, I just wanted to say something about our own team. You know, I say our local team, and really I mean 7 institutions in the Mid-Atlantic and Midwestern region. They're listed there. We partner with Geisinger Health, Hopkins, Ohio State, Penn State, Temple, and the University of Michigan. And the photo is our team about last year at this time when we still got together in person. This is a group that's working really hard to try to accomplish those PCORNet goals locally, including through the HERO study. So HERO focuses on healthcare workers. And I think this is really important topic in COVID, and it's really an particularly important topic for people of color, because even though these individuals have, I think as everybody here knows, these individuals have a major presence amongst healthcare workers in healthcare technical occupations and among other workers whose jobs might bring them into contact with patients. For instance, people who serve food in hospital cafeterias or do housekeeping in hospitals. And I put a bunch of statistics here from the Bureau of Labor Statistics. I think none of these will probably be a surprise, but I just want to point out a couple of them. For example, that 37% of nursing, psychiatric, and home health aides are Black or African American. A full 25% of phlebotomists in the US are Black or African American, and 27% of healthcare support professionals. And this is a big formal category from the Bureau of Labor Statistics, but it includes occupations like home health aides, nursing assistants, orderlies, medical assistants, and they also are Black or African American. So a really major presence in the healthcare setting. And African Americans may be at higher risk of actually contracting COVID-19 than other healthcare workers, and other minority groups are in this situation. Just a quote, you know, this is a concern that's just emerging over the last months during the COVID pandemic. But one study is particularly notable, and it gathered data from across the United States and the UK, and it showed that Black, Asian, and other minority ethnic healthcare workers are at especially high risk of COVID-19, with at least a 5-fold risk of infection compared to the non-Hispanic white general community. So, so that's that the healthcare workers are at risk, but also minority healthcare workers are at particular risk. And then they delved a little bit more deeply and showed that Black and Hispanic or Latino healthcare workers are actually more likely to report inadequate personal protection access, that for instance, masks, or have to reuse this type of equipment compared with non-Hispanic white individuals in the healthcare setting. And they're more likely to be working in clinical settings that have greater exposure to patients with COVID-19. So have particularly, you know, it's consistent with the idea that there's particularly elevated risk. This is obviously, you know, not where we want to be. And as a result, my belief is that the patient-centered approach that PATH and PCORNet take might be a pathway for doing better. And here's why I want to unpack this idea of patient-centered research a little bit. The goal is really to engage diverse patients as partners who can help steer the research process. So actually have patients be members of the research team, have people who are actually making clinical decisions or making you know, decisions about healthcare, like clinicians, to help form the research questions, ask the right research questions, and then also once we find something out in the research process, to make sure that the research findings apply to everybody who needs to know. And in particular, in this case with this disparity, it seems like we need to make sure that this includes people of color to help protect themselves and their families. So that's all a lot of background as to what is the HERO study. HERO, their motto is HERO is here to help. And basically there's an invitation out to any healthcare worker across the whole country with really very few constraints around that. I'll give you the details in a minute. But they would like people to join the HERO mission, acknowledging, as I just did, that it's a difficult time for healthcare workers on the COVID-19 fronts. They're both caring for patients in uncertain times and trying to protect themselves and their families. And so So Duke, with funding from PCORI and partnering with sites around the country, has formed this HERO registry. So why did the HERO group focus on healthcare workers? For some of the reasons I just pointed out, healthcare workers are on the front lines. Their duties to protect and treat all of us, but that this puts them at increased risk, both themselves and their families. This risk is not just for physical health problems, potentially, contracting the virus, but also it's an extremely stressful time, just in terms of balancing everything and dealing with social distancing and worrying about what's going to happen to you and the people you love. So as a result, the HERO team felt that it was really we need to get evidence to help healthcare workers and their families to keep them safe and healthy, and ultimately that will also protect everyone in the country. So what does this mean? What is the HERO registry? So it's basically a collection of healthcare workers who go to the website and click and join. It's a virtual community. Their goal is to engage healthcare workers in this research community, and they really want to understand these workers' experiences and interests. They track critical health outcomes associated with caring for patients with COVID-19, as well as stress and burnout. So there's a series of surveys that can be delivered through the online portal. Surveys are optional. You can complete them or not, but it's a way that the HERO group is trying to understand, what's happening to healthcare workers and what are they worrying about, and where are their gaps where we might be able to make improvements to the way that healthcare is delivered that would protect healthcare workers. HERO also, for folks who join the registry, then have an opportunity to hear about studies that HERO is engaged in. So joining the registry doesn't obligate you to participate in studies. It just helps people hear about studies that are focused on trying to understand health issues for healthcare workers related to COVID, or to test preventive or treatment strategies. And then finally, they say that together, healthcare workers can engage to help find out the answers that will protect and improve the health and well-being of America's frontline. And they cite the whole country, because this is a national initiative, and there are over 16,000 people across the U.S. that have enrolled in the HERO registry to date. So more pictorially, the steps to working with HERO are pretty simple. You can join the registry, which is just a pretty simple online process. I've done it. It didn't take very long at all. They have some short surveys, and potentially you can participate in future clinical studies. As well, there's a big commitment on the part of the HERO team to make sure that they disseminate the findings from HERO research back through the online portal, to try to make sure that everybody who is actually participating in this community finds out what's learned and can apply that information to their own personal situation as soon as possible. You don't have to rely on trying to make sure that you heard about the results in the newspaper, on the radio, or online. Actually, it will you get prompted with the results personally. And then a really important part in working within the framework of patient-centered research is that they really ask participants to please share ideas for problems that need to get addressed and that could be reframed as research. And I can tell you a little bit about the types of topics that have come up so far in that area. So who should join? Who's eligible? They have a really very broad inclusion criteria. So anyone who works in a setting where people receive healthcare is eligible to join. And I think when this first came out, a lot of people expressed some confusion about that. They said, well, I deliver food trays in the hospital. I'm not really a healthcare worker, but actually, according to the formal definition of a healthcare worker, that someone like that is a healthcare worker. So anyone who works in a setting where people receive healthcare, including nurses, therapists, physicians, emergency responders, food service workers, environmental service workers, interpreters, transporters, and many others, all anybody who could come in contact with somebody who's being evaluated or treated for COVID would be welcome to join the HERO registry. You need to be at least age 18 or above. That's the one constraint. Enrollment's free. It only takes a few minutes. It's completely online. And then anybody who joins is able to participate as much or as little as they would like. There's a storytelling component within the HERO registry, which is pretty interesting. You can go in and listen to other people's experiences, see what it's like to provide healthcare in your region or in other regions. And there's a quote here from Jorge Lascano from Florida. He's a critical care doc from down in Florida. And one of the things he said when he shared just a brief story online, basically you can see he's doing it from his own laptop. He said, it's hard to think that by doing my daily job, not only can I get sick, but I can infect those I love the most. This is the time to be proactive, to develop ways to stay safe on the front lines. And so he encourages everyone to be part of HERO and part of the solution. So just briefly, to sum up what the HERO project does, it considers what does COVID-19 mean for people who work around patients. Participants are asked to think about what can be done to protect workers from infection, are able to express interest in potentially joining a funded HERO study. They're able to share their experience about what COVID's been like as a frontline health worker, and think about and suggest ideas for additional questions. And for instance, these are some of the questions that are being brought up and considered as the next HERO study. How effective are approaches for handling stress? Does zinc help to prevent infection? And considering what are some of the best ways to support families of healthcare workers during these challenging times. So that's really what I had to present about the HERO registry itself. I wanted to, but before I wrap up and take questions, I wanted to provide some resources and suggest some possible next steps. First, one resource that we've developed here at the University of Pittsburgh through our PATH team is a related storytelling venture. Actually, it was hearing about this storytelling project that had then built the other one right into HERO. So I want to let you know that if you have a story related to COVID-19 or frankly any other topic that you feel that others really need to hear about what it's like to struggle with illness, to try to stay healthy, to act as a caregiver, taking care of someone else who might be ill and or access the healthcare system, that the Story Booth project is collecting these stories and trying to amplify the voices. We invite researchers to listen to the stories and be inspired to ask the right questions to improve healthcare based on the real experiences of real people. We also work to create connections between researchers and patients with shared interests. Basically trying to help build teams that include the storytellers who are interested in doing so. We've got over 700 stories to date, collected both by Pitt and Johns Hopkins team, and it includes a special collection focusing on COVID-19. So, and this is just a picture of one of our patient partners from Tennessee. I've got a few links on this slide decks that might be useful for providing information that's specific to healthcare workers in the context of COVID-19. One of them is for the resources put out by the Allegheny County Health Department. One is from the state and one is from the CDC. So they have a whole bunch of great resources if you want to learn more about the dilemmas that healthcare workers are facing and recommended ways to try to protect themselves and their families. And finally, if you'd like to learn more, please feel free to reach out to me. I put my email here. I've got the link for the HERO registry. That's if you want to join the HERO registry, that's all you need to do. Just click on that link. It's very easy. And then more information about the PATH network or PROCOREnet are at the websites there. And then again, the Story Booth links are down at the bottom. So I'm going to go ahead and
Dr. McTeague, is it possible to put those that those links that were there in that last slide maybe into the chat for folks. I'm not sure if how we'll be doing the sharing of the slides if we do it all, but perhaps,
Okay.
yeah, that would be awesome.
Excellent.
And I think what we're going to do is, for the sake of time, we'll transition to Mr. Morris from the Urban League. And then as folks are, if you have questions, please submit them here in the chat. And I didn't see that anything yet popped up, Dr. Boutique. This is so great and critical information. Thank you for all of the action steps and such great work. Obviously, the storytelling component is just so needed, so needed, and really creates community in many different ways. So we thank you. And so we're going to, and we're very excited to hear from Mr. Richard Morris, who is on from the Urban League. And I'll let you introduce yourself, I guess. So we'll just, and I'm not sure if you're planning on sharing slides, Mr. Morris, but
I will not, but I'll
Okay.
provide stuff. First of all, thank you for giving me this opportunity. I'm going to talk a little bit today about housing in the pandemic. The first thing is that many of us continue to hear these various deadlines that have been established by the local and national government regarding either mortgage foreclosure or rental assistance. So I'm going to walk you through a little bit of that, and then also talk about where the crisis points are and how we can help people access these services. So the first thing is, let's take people who live in subsidized housing. Subsidized housing includes people with Section 8 vouchers. It includes folks who live in senior citizen facilities, people who live in planned communities, and people who live like in Crawford Square. If you know of a person that's been impacted by COVID, or they've had their income reduced, they can simply go to their management office and provide that information, and their rent can be reduced. So please understand that. They go into the rent office, there is no penalty, and they can get their rent reduced based on their income. Because all rent in subsidized housing, be it Section 8 voucher, senior citizen facility, planned community, or a place like Crawford Square, you don't pay any more than 30% of your income. The second is that if you are a mommy or daddy who's involved with the CYF system, if you're experiencing some difficulties regarding rent, or your housing is unstable, the first place that you should go to is to your CYF worker. They can put you in touch with a program that can provide you with initial assistance, or if you're living with assistance, to allow you to live with that person. So let's say your grandma takes you in and she says, well, you know, I need some help with the light or the gas, but you can stay here, you know, till you get your life together. There is a program within CYF that will help you gain access to that resource, okay? So now let's move to people who are facing a mortgage, and their situation is such that they haven't reached the point of foreclosure, but they're a couple months behind. There are two opportunities. The first opportunity is that if you're a City of Pittsburgh resident, you can call your 908-211, and they will direct you to an agency that can give you up to 3 months income, or not 3 months in payments, to get your mortgage back on track. The same can occur if you apply for PHFA COVID. There is a program that provides that same opportunity. Now, if you're at the point where you've got what is called an Act 91 notice, then the first thing that you should do is to contact Save Your Home. And that number is 1-866-298-8020. Now, the reason that is so important is that your case, if accepted, then is under the control of a judge. And the judge will hear your concerns, try to solve them with the lender, and make sure that you stay in your home during this process. Depending on what your circumstances are and your ability to pay and to work it out, your case can be anywhere in the court system from, I'll say, 6 months to a year, depending on what your circumstances are. So you don't want to feel that you're at the end of your rope when you reach the point of getting an Act 91 where the sheriff comes out and gives you a foreclosure notice. Okay, so now we're going to talk about general delinquency and eviction. All right. Anyone who's involved in general delinquency, which means that you owe money, but you haven't reached the point of foreclosure, can do a couple of things. First is you should go to your landlord and try to work out a payment arrangement based on your circumstance. The second is that if you're a City of Pittsburgh resident, you should call United Way 211 and ask for the Housing Opportunity Fund. The third is that you can go to PHFA COVID-19 and get some assistance, but you need to apply for that assistance by November the 4th. Anything that is part of the CARES Act will end by the end of the year unless Congress and the president decide to extend it. The legislation is written specifically to take people to the end of the year. However, those of us who work in the system can tell you that there is a lot of money that will be available when we come to 12/31, and we believe that people will continue to need this support at least for another 90 to 120 days. So we will be out beating the bushes, asking for the excess dollars to continue to be in the system. So let's say now you are a person that you're facing eviction. So you have an eviction notice, you've been to magistrate's court. What are your options? You have two options. The first is that you can go to Allegheny Links if you're a county resident, and they can provide you with dollars up to $1,500 to assist you to pay your eviction. And that number is 1-866-730-2368. And I will supply the flyers for these various things. The second is if you're a City of Pittsburgh resident, you can again go to United Way 211 and ask for the Housing Opportunity Fund, and they can provide assistance for you as well. Now, will you get all of the money that you need? The answer is no. But the expectation is that during this period of the pandemic that you have put some money aside and that we can find a willing landlord that will assist you in terms of knocking off some of the fees, working with you on the payment plan. But the days are gone when an agency like the Urban League will be able to simply provide you with all the dollars that you need. All of these programs that I've mentioned have a couple of things that are important. One is you have to be able to show proof of need, which is why you need it, what your income is, and most importantly, we need to know how you're going to pay the rent going forward. Now, what this is designed to do is to give you an opportunity to recover. And some of the programs have provisions in them that you can come back more than once to get assistance. So why is housing so crucial? It's crucial for this reason. If you don't have housing, none of the rest of it works. It puts you in a situation where your children may not be safe, you cannot move forward in your job, and most importantly, people have to remember that in the United States of America, safe, affordable housing is not a right, which means that our country isn't built upon everyone has safe, affordable housing. So having housing is right. I think that it is the most important piece. Stable, once you have stable housing, you can move from there. So I thank you. Erica, I don't know what you all want me to do next, but I do thank you for the opportunity. I will submit flyers to them so it can be part of the packet. But again, please encourage people to utilize the resources that are available and do not wait until the last minute. Take care.
Thank you, Mr. Morris. Kristen, if you're ready, you can share your screen.
Thank you. Let me just get it shared. All right. I think it is sharing. So let me know if that is not the case. And am I sharing my screen or my slides? Just so I...
Whichever is easiest for you.
Are you seeing just the slides right now? Or are you seeing the Zoom on top of it?
Oh, the slides, just the slides.
Okay, perfect. So thank you all very much for the chance to speak today. I'm really excited to pair the remarks I have with what you have already heard. I think they complement each other so nicely. I'm Kristen Ray. I'm a general pediatrician and health services researcher. I'm broadly interested in how place shapes opportunity and health, in part because of a very mobile childhood, living in lots of different places and seeing how education and health varied with where one lived. And I'm here today as part of the Pittsburgh study, which is a longitudinal community partnered study that is designed to help all children in our region to thrive. And it is guided by scientific committees that include clinicians, researchers, as well as public health and social service, community members, and community agencies, with the goal of scientific committees within the study all having 50% community representation. Today, I'm going to talk about a piece of the Pittsburgh study called the Family Strength Survey, and this grew out of the ongoing partnership that we have as the Pittsburgh study really allowed this initiative to take place as COVID-19 came into our lives. And so as a group at that time, as a stay-at-home order started coming down, all of the people who are part of the Pittsburgh study started, our ongoing communication and crosstalk. We realized we were all very concerned about how this was going to, particularly the stay-at-home order and the school closure was going to impact children and families. And so we wanted a way to give voice to the many ways that families were experiencing the pandemic, and particularly to identify potentially hidden issues like unmet needs or disparities in needs across racial, ethnic, or socioeconomic groups. So with that background, let me go to the overall goal of the Family Strength Survey was we wanted to understand the evolving experiences of families with children in the Western PA region during COVID-19. We started this as a weekly survey that we wanted to engage in rapid cycle data collection and dissemination. So our plan was every week, we'd have families answer a survey, and then at the end of that week, we would summarize those results and send it out to our community partners, including the health department, DHS, and many community agencies that had partnered with us on this. Our commitment to this weekly analysis and reports really grew out of a commitment to wanting to do data that would drive action in this time where we need action. And that we also weren't going to just send reports, but we also made a point of engaging with different partners as we identified different needs. And the last one of our other kind of driving interests here was making sure that we also lifted up the strengths that families had, and so focused not just on what people need, but also what they were experiencing and the many dimensions of what children need, and capturing how families were feeling in those domains. And that piece in particular was informed by a prior study that Anna Ettinger and many others within the Pittsburgh study had been part of, where through concept mapping with families and community members in multiple neighborhoods across Pittsburgh, they spent time talking about what does child thriving look like, and that led to this overarching model that drives much of the work we do as the Pittsburgh Study, with the idea that childhood thriving includes not only strong minds, strong bodies, but also positive identity and self-worth, but needs to be encompassed in a world that includes safety, fun, and happiness, healthy environments, vibrant communities, caring relationships, and racial justice, equity, and inclusion. So these are all questions. These informed many of the most constant questions we have in the survey from week to week. So what we actually did is, and this needs a big edit, we just finished week 26. So we have been posting this survey weekly since the first week of April. And it's available in the website there, or we have a tinyurl.com/412family. It's in English and Spanish online. It's also available by phone in English and Spanish. Anyone over 18 who lives in Western Pennsylvania and has a child in their house can participate. It's a 6-minute survey, IRB reviewed, and at the end, every week, people have the option of submitting their contact information, and if they do so, 5 people are chosen to receive a $100 gift card. This is what the website looks like in terms of entry into the Family Strength Survey. And so here are the multiple different options in terms of taking it in English or Spanish or by phone. And I'm just going to breeze through. I want to make sure we have time for questions at the end. So I'm going to go through maybe some highlights of results. Some of our core questions, and let me actually make this as big as I can. So some of our core questions are asking about whether families are able to do the things that they told us years ago in the concept mapping are important. And so that's including meeting children's basic needs, as well as helping them be well-adjusted socially, mentally, and emotionally. And so what this graph is showing here, you see the different questions along the side, and then the colors are showing all the way from week 1 to week 26, with the last week being what you're seeing in the darkest red here. And so you can see that there are some areas that families on average have felt they are better able to provide for their family throughout the pandemic, including on average, more families in our region have felt like they can meet some of the material needs. Although when we get into more detailed analysis, you can see that there's many families struggling with this. But also, only at the beginning of the pandemic, only 1 in 3 families, or less than 1 in 3 families, felt like they were able to help their children be well-adjusted socially, mentally, and emotionally. And that's improved over time, but we're still at less than half of families feeling they can do that. These are some additional questions spanning also feeling loved, safe, and happy, being able to be connected with community as a place families are still struggling, and then being able to protect your children and your family from inequality, racism, and prejudice actually has, in most recent weeks, only about 65% of families have felt like that's something that they feel like they can do, which has declined over time. This is how families feel like they have been able to do in terms of caring for themselves. And so you can see it's a similar question, parents saying less than 20% felt that they were able to help themselves feel well-adjusted socially, mentally, and emotionally at the beginning of this time back in April. And we're maybe at 25% of parents feeling that now. And then there's lots of other domains. In the interest of time, I'm going to move a little quickly through some of this, but we ask some families, these are questions about whether families feel like they can get adequate information, protection, and care for COVID. And you can see some variation throughout the summer with that. We've been asking for the last, since the middle of the summer, about interest in potentially receiving the vaccine. And this is something that when a vaccine becomes available, and you can see that there has been a decline over time in families saying that they would definitely get the vaccine. And so this is some information that we think is really important. And we know there's lots of people working on issues around this in our community now. And so making sure that we connect with people on that is crucial for sure. And then another piece of the survey is we've been asking about unmet needs. And this, I'll just do this first slide in this area, showing that the green lines here are showing in the first 10 weeks of the pandemic in April, May, and June, what families were saying in terms of what needs they had. Those in green are saying that they had a need, but they got a resource and their need was met. Those in yellow are the percent of families saying they had a need, they got a resource, but they still have some more unmet need. And those who are in red are saying they had a need and they weren't able to access anything and they still have that need. So I think food assistance shows that there was massive food mobilization efforts early on through a range of different ways in terms of school lunches and mass distributions. And so you can see that increasing numbers of people were able to access that food over the first 2 months of the pandemic, with decreasing numbers of people saying that they had no resource in that space, although there still clearly was some unmet need. Financial assistance, certainly we had lots of write-ins that people were telling us about their experience. And so there were lots of delays with getting access to unemployment and those sorts of things. And so you can see that the unmet need, either with some resource use or no resource use, remained high even into June. And I'm going to skip through. We have similar looks at other areas of resource needs. And then we've also been able to drill down within individual weeks to say, well, how do these needs vary by respondent demographics? And so these data have shown us that those who had the lowest pre-pandemic income, under $50,000 a year, had the greatest need for food assistance and financial assistance relative to other pre-pandemic income. And also in the early weeks, we were able to identify variation by race and ethnicity in unmet need for food assistance, showing kind of pairing on top of what was in the national and local news about the weight of the pandemic and infection, this other kind of social sequela of the stay-at-home order falling disproportionately on Black and Brown communities as well. These unmet family needs continue today. This is from last week. Again, looking by pre-pandemic family income, that over a third of families who had family income less than $50,000 a year before the pandemic, 1 in 3 families are still saying they need more food assistance than they're getting. Over 1 in 4 families are saying they have more need for support with utilities in particular as another high need. And so that's just a smattering of some of the different ways we've been able to look at kind of over time in given weeks, what families are needing. But one of our key ideas and principles is that data is only useful if it's used. And so we, collecting this data is only half of our effort, and the other half is pushing it out as actively as we can to anyone who might be able to engage in it and help us to partner in thinking about what are the next steps based on what families are telling us. So multiple levels. One is we've been posting reports every week on the website. So anyone who's going to take the survey can click over also and see kind of some of the information that we've posted in prior weeks. We've been sharing reports with partner organizations throughout this time, including the Health Department, DHS, United Way, as well as Urban Kind and many others. And then as we've identified specific issues that either from the data or from the write-ins, we've had more focused conversations with community organizations, social service agencies, employers to talk about what we're hearing. And they have helped us with both improving the questions, drilling down more so they can think about solutions. We've also highlighted resources and created a growing list of resources to share with families based on both what community organizations have told us already exists and we need to get the message out about, as well as what survey respondents have told us they've used and has been helpful. And then we also, when we identify a really there have been a couple things where we see just families repeatedly falling through gaps, and those are some places where we've convened some sit downs and talking together about. One was food, where families who were relying on SNAP or food stamps and also had young children in the home and limited transportation options were in this quandary where they couldn't use their benefits online. They couldn't get to a store in a way they felt safe. And so that catalyzed a lot of conversations about increasing food delivery during the April-May time period to ramp up some of those services. We also identified that many in the Latinx community were reporting disproportionately unmet resource needs. And so we had a conversation between some of the organizations serving the Latinx community and United Way to improve kind of language services and outreach, so that as they serve as a clearinghouse for connecting with resources, they could be a still heightened resource for those community members. And then mental health is something we've been talking with. DHS in particular has asked us to drill deeper into understanding what unmet needs are and how we can improve not just what the needs are, but what are the barriers and how we can move past them. So this is, let me peek at the time. I'll wrap up in just maybe 2 minutes. This is the resource page that we've continued to grow over time through what community partners have told us about and what families themselves have written in as being important or helpful to them. And so it spans information, at the top related to COVID, but all the way down to utility housing resources, as was clearly something that families need a lot of, as discussed previously. And then also mental health resources, both for children and for their parents, and ways to just focus on having fun with our family members during this time as well. So running the full gamut there. We've have some really talented partners. I am not a graphic designer, but some of our team members have created some beautiful infographics highlighting both the needs and some resources for individuals. And in terms of what's next for the survey, we've done 26 weekly surveys. So we've gone through a full half of a year with weekly surveys, and we are now transitioning to monthly surveys. So there's an opportunity to take it in October and then again in November. And we will continue to share the reports. Our goal is really to elevate the stories, the strengths, and the needs of families with children in our region throughout this time. So anyone interested in seeing the reports, looking at the resources, participating, or telling other people about the opportunity to participate could go to either of these two websites here, and I'll put it in the chat in a moment. I have to acknowledge huge team, including people within Children's and PIT, as well as partner organizations, and many community members who have come onto the Pittsburgh study in different capacities, helping us to formulate our questions, think about interpretation, recruit community members to participate, and join us in drafting scientific manuscripts. And then I wanted to encourage just a couple steps to take charge of the health of kids in our region. One is, I believe last I checked, there's still a couple days left in census taking. And so in that case, make sure that we're all being counted and that kids in particular are being counted. Children under 5 are the most likely to be undercounted, and that's crucial for resources. For families who are at home and wanting more fun in their life with kids, there's the ability to sign up for a free book every month through the Dolly Parton's Imagination Library on this website. And so I think that's a really important resource at this time. And then final message as a pediatrician is that we are here, we are available, we're willing to partner with families to figure out the best way to meet their needs, whether it's by phone, by telehealth, or in person. We're doing it all. And so if there's any questions, just call. We're happy to make sure that we're getting kids the care they need during this time. So I will put a couple things in the chat based on that. And thanks so much for the chance to speak on this.
Thank you, Kristen. Those were, oh, my camera's not on. Those are great resources and action steps to really wrap everything back up. And also, we often forget about kids. So I think it was good to, link in kids because they're also going through this pandemic as well. So any resources that we can share is great. So we just have a few more things before we wrap up. So we had a few resources of our own. Again, I'm just highlighting the resources of our speakers. So of course, the HEROES study, a link to the Urban League of Greater Pittsburgh's housing website, and then a link to the Pittsburgh study. And then also on the right, you'll see just some additional resources from the CDC. Did you have anything to add to this? Sorry. No? Okay. You can go to the next slide, Taylor. Cool, and then just some more, again, additional resources. We wanted to be mindful of folks in the space. So if you weren't in the housing or research, we also have additional resources. So highlighting Healthy Start and the work that they're doing around doulas and breastfeeding and anything in relation to fatherhood. I'm not sure about the Amber Grant. And then of course, just the CDC, you can often visit for information about COVID.
Yeah, so thanks again for being here. And I think it's so interesting, even with all three of the different work that you all are engaging in. There is such a dedication to the storytelling component and really honoring the lived experience of folks and really taking the time to listen to those narratives and then actually doing something with that. I think is really cool. And also, unfortunately, not the way that it's always been done. But I think if there's any silver lining to the pandemic, it could be that these strong resources and tactics, I think, could really be lifted up. So I'm just just really grateful that you all are showing up in the way that you are. So thank you. So for the folks in the room here, we do these lunch and learns once a month. They're connected to the Take Charge of Your Health page, which is in the Pittsburgh, the New Pittsburgh Courier, sorry. And we do one every month. And next month, we're going to be doing exploring PTSD in the time of COVID-19. So certainly if you are not on our newsletter and you want info on how to get that Zoom link, feel free to email me and I will add you. And also there's a follow-up survey if you use that QR code there. If we get a copy of the list of folks who were in this room, we can also email it, but certainly we're iteratively trying to do better. So please contribute your thoughts as you can. And thank you to all of our panelists. This was so cool. Thank you. This is really great. Thank you for the work.
Thanks, everybody.